This conference will now be recorded.
Welcome to our second Practice Management Symposium, Transforming the Way Your Patients and Families Access Care. So today is going to be all focused on access. We're going to provide you with some quick updates regarding our new specialists, our immediate care, and our Manager of Patient Care Operations, Kate Schmeissing, will talk about our new location in Skokie. Our provider-to-provider hotline, LurieMD, will be covered by Nora, Cavanaugh, our Senior Project Manager for Care Access Initiatives, who recently moved into her new role as Senior Project Manager of our Centralized Access Center. Joining us as Director of our Centralized Access Center is Matt Ludwig. He'll discuss all our updates from Kids Talk. And you'll be excited to hear from Dr. Ravi Patel, who is the Senior Director of our Digital Front Door. And he'll be describing all the ways patients can now make appointments and do other things digitally. We want this to be an interactive session for you. So please type in your questions throughout the presentations, and our speakers will address them at the end in our chat room. And now I'll introduce Julie Kalkbrenner. Julie is our physician liaison for our West and Northwest regions.
Thank you, Paula, and thank you everybody for joining us today. We are delighted to announce that we will be having our coding conference this year. It will be a virtual conference, and we are scheduled to have it on April 21st, Wednesday morning from 9 to 11 a.m. Dr. Richard Tuck will be speaking for us, and he's going to give a 2-hour update on the 2021 changes to CPT coding, valuation and management, and all the other updates related to 2021, as well as touching on telehealth coding best practices and behavioral health coding. So we hope to open registration for this program late February, and that will be available on our website. So we hope you can see us there virtually. And then also we have some new specialists. These specialists did come on board in the fall, but they've kind of been able to fine tune their clinics a little bit, or they have just recently started at a new location. So we have Dr. Bianco with endocrinology out at downtown Lincoln Park, Lake Forest, Arlington Heights, and Skokie. And we're very happy to announce that Joshua Baker is another physician within genetics seeing patients. We have a little bit of relief there. And then 2 CDH providers, Dr. Mary McCauley. She just recently has hired a diabetes educator, so we're looking to really expand diabetes care out in the western suburbs. Dr. Murad O'Mary is a neurologist out there, and he is really going to be focusing on traumatic brain injury as well as concussions, and he's at CDH and Delnor. Dr. Gandersoe is one of our ENT providers, and he is actually going to be doing surgeries, ENT surgeries down at New Lenox. So we're delighted to have him there. Dr. Rosenthal was previously doing these, and she has actually moved her practice up north to our Skokie location. And then with ophthalmology, Dr. Rawson, she is one of our lovely ophthalmologists, and she is focusing on eye muscle disorders. And then we have Dr. Kaj, one of our GI specialists, and she is actually taking over Dr. Kagawalla's clinics. Dr. Kagawalla has entered somewhat of a retirement, at least a retirement from Lurie Children. I believe he's still in the community, but just not through Lurie. So Dr. Kaj will be taking over his clinics at the main hospital, Lincoln Park, and New Lenox locations. And lastly, we have Dr. McGrath, one of our new plastic surgeons. So she's an addition to our plastic surgery team. And that's our provider update right now. And back to Chad.
Well, thanks, Julie. Hi, everybody. I'm Chad Worley. For those of you who don't know me, I am the liaison for the north side of the city and north and northwest suburbs. And well, before this pandemic started, I had just started my role at Lurie, and I got to come into your offices and meet you And that is one of the things that I love doing as a professional, is meeting people. But I've kind of been shut down since March and haven't been able to see you or meet some of you that are new. But like we all are doing, we're adapting, and we're happy to adapt because we have found really great new ways to communicate with you. And you've been seeing our updates, and I hope you've been reading them and enjoying them. We have had great responses about that. And some of the things that we've been doing to communicate with you has been sending out our e-communications for COVID-19 that we send out as needed. And then we send out our Lurie-centric newsletters, which are community provider communications, what we now call it. And you get that in the beginning of every month. And we update you with new providers, things that are going on with Lurie, and some educational events and all that. As in addition to that, is we provide you our schedules that normally we used to hand out to you when we saw you in person. And then the other things that we're doing is this our webinars, this symposium, and then our new virtual specialist visits. Now, I hope that some of you have been enjoying these, because at least through the recordings, we're very excited to bring this part virtually to you guys. It not only frees up our specialist schedules, but it frees up your schedules as well. And so what we're trying to do is provide you with an opportunity to meet certain divisions within our department and meet some of the providers, and then hear about their special skills. As you see here on the presentation, our last one we did was for our head and neck surgery team. And a lot of you got to meet Dr. Johnson, Metalazzo, and Dr. Rastatter. And what we tried to do is we try to separate it out throughout the day. So there's different times, knowing that you guys have busy schedules, right? So we try to do it in the morning and afternoon and the evening. However, with that said, I would love to hear some feedback from some of you. If you think that the evening time isn't worth your while, or the morning, let us know, because we can do a 12, a 12:30, or a 1 o'clock. But we would love your feedback, because this is going to be a great way for us to introduce you not only to our divisions, but to some of our new specialists. So we're very, very excited about this. So we love, like I said, feedback would be great on that. So with that, I'd like to introduce Kate Schmessing of our Skokie office. Kate, are you available?
I am. Can you hear me okay?
You are very muffled right now.
Hello?
Again. Okay, Kate, we're having a little technical difficulty with your.
Let's see. Can you hear me better?
Unfortunately, no, it's not. So we're gonna go. I'm gonna go ahead.
Better?
We can hear you. It's just you sound like you're from a Scooby-Doo movie. So we're gonna go ahead and mute yourself, and I'll go ahead and push through on this part. It's okay. So as many of you know, we have opened up our new Skokie location, and we are super, super excited to be able to provide this for you. And we have so many of our great specialties there: allergy, dermatology, endocrine, gastro, genetics, neurology, pediatric surgery, sleep medicine, urology. And we have these wonderful, wonderful wraparound services with cardiology and echo. And then we all know, we all heard it last week, sports are back in Illinois. So these kids are going to be back. They're going to be playing sports, and there's going to be injuries. And we're here for them. So we're going to have an orthopedic and sports medicine team. We have medical imaging with ultrasound, and we will have CAS care there as well. So we will have that. We will have that for you, as well as we're going to have otolaryngology, ENT, and audiology. And some of the other services we offer is blood draw, lab services, medical imaging, ultrasound, and physical therapy. It is a COVID testing site as well, so appointments will be needed, but we are But we're looking forward to having you meet some of our physicians that will be at Skokie. And if there is a specialty that's going to be at Skokie that you would particularly like me to introduce you to, I would be happy to do so. So go ahead and message me, email me, call me, and we can set that appointment up. And then the other thing I'd like to mention today is our immediate care services that we have at Northbrook and in Chicago. We are very proud to offer these services, and we know as busy pediatricians like yourselves that you can't always be open all the time. And so that's what we're here for. We're here to help supplement you when your offices are closed or you're not available. So we're here to help you with that. And we have convenient hours, Monday through Friday, 4 p.m. to 10 p.m. Saturdays, Sundays, and holidays are noon to 6. And walk-ins are definitely available, and of course appointments too. So I just want to thank you for your time, but now let's get into the kind of the nitty-gritty of what we're here for today. And we're all here to learn about access into Lurie Children's has been a challenge for some of you, and we recognize that. But the one thing we do want to let you know is we hear you, and we're here for you, and we're putting together ways to really get a hold of us, to make appointments easier, to speak to our specialists easier. But without further ado, let me turn you over to Nora Cavanaugh, who will talk to you more about LurieMD. Nora?
And Chad, I just wanted to say a few things about Nora. Nora is celebrating her 25th year at Lurie Children's this next week. And she started out as a nurse. She's devoted the last several years to trying to improve access and more recently digital access. So I just had to pop that in. Thanks for being here. And Nora doesn't have a camera, so you'll hear her voice and see the slide, but you won't see Nora.
Thank you, Paula. This is Nora, and as Paula mentioned, I'm now working as a project manager within the Centralized Access office and work most closely with EPIC-related digital projects. So happy to help introduce you to our LurieMD offering. Those of you that have been around for these past 25 years with me know that in the past we had a physician connection service called the VIP line. And what we tried to accomplish with LurieMD was to bring that service into the 21st century and offer some supporting technology to further ensure that we have connections for you with our specialists at Lurie. If you call the LurieMD line, 1-855-LurieMD, one of our Centralized Access representatives in KidStock will answer that call for you. They will take some patient information from you, which I know you may be in a hurry, but what that allows is for us to, using our Rapid Connect platform, to send that information to our providers, and it is protected. We don't have to worry about that getting discovered. And that allows our Lurie providers to be prepared for a successful phone call with you. In the event where this is a shared patient scenario, we'll ask for the medical record and a brief scenario of what's going on. And again, our providers can have their records open and be available to answer your questions more efficiently. As I heard some of my colleagues mention COVID and how that changed some things for us. As we've seen in the last few months, our LurieMD line has sort of become an information line, if you will. And in particular for our infectious disease providers, they've been answering calls on COVID management and, you know, the testing scenarios that change quite frequently. This has been an easy way for us to connect your doctors with our doctors at Lurie. For those of you that are with the hospitalist team, we've also noticed that our hospitalists are using this line to help with managing patients out in the community emergency departments. when the standard protocols just aren't quite doing the trick. Or again, in the COVID scenario where they really don't want patients to be transferring to too many facilities, so that we can do our best to make sure that the patient receives the care in the location where they are at. At this point in time, we receive about 100 phone calls a month, and these are priority calls for our call agents. And if you need to speak with someone urgently, we will do our best to arrange a phone call returned within 30 minutes. Otherwise, we just notify our providers and they'll get back to you in between their OR cases or clinic visits. And if you have any questions for me, please type them in and I will do my best to answer those along with my colleagues. And I think I will take then this opportunity to introduce Matt Ludwig to you. He is the director of our Centralized Access Center. He's filling Winnie's very large shoes and been doing a wonderful job. We are refocusing efforts on making sure that our patients are scheduled in a timely manner. And with no further ado, Matt, welcome and thank you for joining this presentation.
Matt, if you could unmute yourself. And Matt, if you could unmute yourself, we'd appreciate it.
You know what, Chad, he's going to try calling right back in.
Okay. We're sorry for the delay, everybody. We'll be right back with you. And Matthew Ludwig of Kids Doc, our Centralized Access Center, will be right with us.
Hi, can everyone hear me?
Yes, we hear you great. Thank you, Matt. Take over.
That is not always the best sign coming from someone in the call center, but I apologize for the delay there. I was stuck on mute for a moment, so I apologize. *6 is always the trick. Thank you again for the kind words, Nora, and that introduction. As she mentioned, I'm the new director here in the Centralized Access Center. Really appreciate the opportunity to connect with this group in particular and look forward to future conversations beyond this discussion. If we could just go on to the next slide, please. Again, Nora already introduced herself as our Senior Project Manager here. I also wanted to take a moment to introduce Corey James, who will be going through a couple of the slides as well. And again, I'm Matt here over at the new director in this role. So look forward to future conversations with this whole group. So what is the Centralized Access Center and what are our goals? Where are we moving forward? Really, this department is designed to get the right patient with the right provider, the right location at the right time. That really is our mantra here and something that we focus on a daily basis. What we're doing to make sure that that happens is a continual staffing analysis and ensuring that we have the appropriate resources to maintain our duties, which include not only the inbound call volume, but also referral management by dedicating staff specifically to those requests that we receive, largely from this group in particular. One thing that we did want to note is that we are converting to decision trees, which is a shift away from our former process of memorizing the scheduling protocols and then implementing them into Epic largely via the RFS, and occasionally triaging to the divisional back offices based on the specific reason for visit. So through this, through the decision trees, as well as leveraging some of the other technological advancements that we have been able to implement, we are seeing a bit of an improvement, which I'll go into in a little bit, but also there's plenty of work that's yet to be done, and we will outline that through the rest of this presentation. Namely, we will have our IVR, which is our interactive voice recognition software. We will be implementing more opportunities within MyChart, and Dr. Ravi Patel will discuss that at length. And then we'll also briefly discuss an upcoming initiative, which we refer to as Consolidated Scheduling and Registration, and what that means for patients who call in. So this relatively lengthy slide, I won't read verbatim, and I've heard it referenced a couple of times already, but COVID really impacted the world, and we are not immune to that impact. So with that, we were really able to deploy our nursing staff originally to make sure that we were consulting our patients through this originally very ambiguous time when there wasn't a lot of available data or resources, and we wanted to make sure that we were doing all that we could as a centralized access center to have those conversations with our patients and families. This initiative obviously predates me and my role here, so I would defer to some of my teammates if there are any COVID-specific questions on what we did there. We now have a dedicated COVID call center that lives outside of the Centralized Access Center proper, but it is still housed within Lurie Children specifically. With the COVID impact in particular, it did also impact our data, our metrics, and what we were able to do when the volume came back, so to speak, and that our patients and families were trying to get in contact with us. So whoever's controlling the slides, if you don't mind going to the next one. Really our perspective here is transparency through data and really allowing that to generate a conversation. Here are the FY21, so here we start our fiscal year in September. Here are the metrics, so you can see that we did have a higher average speed to answer than we really reach for as a department. This is not hitting our key performance indicators and not where we anticipate we will be moving forward, but we did want to note that we have heard loud and clear that there were wait times, that it was a less than ideal experience for patients and families, and wanted to touch on some of the things that we're doing to make sure that it does not persist and what we anticipate will happen moving forward. So really displaying this data to highlight that the abandonment rate was higher than we'd like it to be, and more importantly, the wait time was higher than we would like it to be, because that's really what the driver is in patients or families not being able to get through, is us being able to answer those calls. For a little bit of background as well, moving beyond the metrics, and I apologize that I'm moving quickly. I just know we have a fairly robust agenda with Dr. Patel coming up next. So if you don't mind moving forward, thank you. And sorry, Chad, is that you that's running the slide deck?
It sure is, and there may be a pause sometimes when I go to slip.
No problem. I just wanted to know who to reference if necessary, so I appreciate it. So this is just an overview of the different roles that we actually have within our Centralized Access Center. So the departmental support assistant, that really is shifting to the Centralized Access representative role. It was originally intended to maintain the main line and facilitate to the appropriate, what we deem core. It's also referred to within the access operating model as an extension of the back office. So then it'll go to the appropriate core for it to be scheduled. Largely in the past, it was scheduled by, that's where the return patients would go, to our Centralized Access representatives. And the new patients would go to our nursing team to undergo that really manual scheduling guideline process that we referenced earlier in this presentation. Those individuals are also the ones who are expected to manage the RFS work queue. the nurses that is, and the centralized access representatives manage the work queue as we shift into decision trees. So as I've outlined in the box with the 2 arrows there, these duties are really centralized now between the DSA and the CAR role. And as we shift more and more to decision trees, we have more functionality within the centralized access representative role. And I know I'm moving very quickly and there will likely be questions and comments, but I would like to hand it off to the manager within the Centralized Access Center, Corey James.
Hi, hopefully everybody can hear me. So yeah, to kind of piggyback onto what Matt was saying, so about a year ago, we started working on the interactive voice response, or it's actually interactive voice recognition software, also known as the IVR software. And so this software is, I kind of liken it to when you call your utility company or perhaps another company where you're given a prompt to say, I want to talk to billing, or I want to speak to a customer service agent. That's kind of what this is like, except on a more simplified scale. We are allowing families to tell us what division they are calling for when they get to the 1-800-KIDS-DOC phone number. And what that's doing is, rather than putting the caller to a mainline agent, the goal of that is to get them to the right person who can actually just schedule them, so they don't have to be transferred around. So when we worked with the company that provided this software to us, one thing that we did learn about this software, it was obviously new to our department, is that on average, IVR software tends to work around 40 to 50% of the time. We implemented the software in December of 2020, and right now we're capturing about 36%. So we still have a little ways to go to get to sort of the benchmark level, but this is actually, 36% is actually not that bad, according to the companies that we worked with to get this software live. So we're excited to continue using that software and allowing families to get to the right person on the first try. And then to talk a little bit about decision trees, which I know Matt alluded to a little bit earlier. So the goal of decision trees is really to convert the knowledge from the master scheduling into questionnaires that all scheduling staff can use. So we're basically leveraging technology that is available through Epic and is used in quite a lot of call centers throughout the country to get the patient scheduled appropriately with the right provider at the right location at the right time. The decision trees were built with the division's partnership. So there was clinician input on every decision tree that we built. And this is something that is helping to improve our access, but also our accuracy. So we started this in November. Well, we went live with our first wave in November of 2019 with 5 divisions listed here: cardiology, ID, orthopedics, ENT, and ped surgery. And more recently, I believe it was this past November, in November 2020, we went live with clinical nutrition, GI, hepatology, and plastic surgery. So right now we're in the project phase, or the build phase, for another, I think it's 8 divisions now listed on this slide. So there's a lot of work going into this with the leadership team and also the divisions, again, with their partnership. So there's going to be some aggressive movement towards adding more departments onto decision trees. And again, with the end goal of kind of putting the knowledge that we've been keeping in big binders in our office, putting that into Epic and allowing our team to schedule more seamlessly and give more access to patient families through the Centralized Access Center. And I think the next slide, I'm gonna go ahead and hand this back to Matt to talk a little bit more about the consolidated scheduling and registration.
Yes, thank you, Corey, and hopefully everyone can still hear me. Really, I'll keep this very high level so that Dr. Patel has a bit of time to give his presentation. But essentially, moving forward, beginning in late March, early April, all individuals who schedule at Lurie Children's will actually register prior to the scheduling event taking place. The benefit in that and what it means for the patients truly is, we wanted to bring this to your attention because Insurance will be necessary at the point of scheduling, which is a little bit different than how we've operated historically. But the reason that we're doing this is really for the patient-family experience, so that we can get closer to that one-call resolution that we're really always striving for here as an access center and generally in access here as an organization. So in the current state, right now, if you are scheduled, you'll also be transferred to our central registration department to then be registered. In the future state, you will effectively be registered immediately prior to the scheduling event taking place, which will all be done in one foul swoop. So we're really excited for this to be implemented. Again, it will happen in early April is our anticipated go live date. And I will hand it off to Dr. Ravi Patel, who's our Senior Director of Digital Health, and really everything that we just outlined would not be possible without all of his hard work and effort. So we are extremely appreciative of everything that he's doing here at Lurie Children.
Excellent. Thanks, Matt. Can everyone, Chad, can you hear me?
Yeah, you sound great. Thank you.
Excellent. So we can go ahead and keep going. I connected with many of you probably about four to 5 months ago, and we had outlined kind of what our digital front door strategy looks like as we move forward. And I just wanted to recap this for everyone as we try to transform how our patients and families can really access care here at Lurie. In particular, you see at the left-hand side, our current access points are heavily physical, and it's a very high-touch phone-based system, as we talked about, and that single-touch system that Matt that just referenced is what we're trying to move towards from a phone-based system. But from an omni-channel experience, the idea here is that patients can reach us beyond just a phone. They can reach us through MyChart, they can reach us through the website, through two-way texting, and as we develop that omni-channel engagement, we're then in parallel developing the end-to-end functionality so that we can really capture patients early on. So those who are considering referrals to us, how do we actually engage with them, provide education, and then all the way down through a good experience for the patient, from digital registration, online scheduling, virtual care options, and then really giving the feedback. I think one of the key factors here for success is we need to have a transparent mentality. I think Matt alluded to it perfectly earlier, in that I'm not hiding anything. Both Matt and I are relatively new in our roles in the last 6 months. We're going to tell you exactly where we are now and where we're going to be in the future. And then we want you all to hold us accountable. Where we don't deliver and you're continuing to have issues in getting your patients access to Lurie, we need to know about it so we can fix those and make it a more streamlined process for our patients. And so on the next page, you'll see that there's three pieces that we're trying to target as we kind of look at improved user access. And so over the past few months, we've really been doing three aspects. So the first piece is improved user access to MyChart. So really a foundational component. So any patient who's ever been seen at Lurie Children's will have the opportunity to sign up for MyChart. That opens up, as we'll see in the next few pages in a demo that I'll show you, opens up the opportunities for patients to schedule themselves for specialty services, ease a lot of the burden to your practices on making those referrals so that patients can get into our system more easily and more quickly. And then also opens the options of direct access, so via virtual services. So whether it be telemedicine, asynchronous e-visits, etc., will all then be available. The second piece is direct scheduling access. So as I said, once you get on here onto the platform, any patients that have had a previous Lurie exposure can get onto MyChart. But in addition to that, starting next Thursday, we will also have the availability for direct scheduling access for all of our Community Connect practices. So if you are on Community Connect leveraging the same instance of Epic, all of your patients that are on MyChart will be able to do what I'll be demonstrating. And then the last piece is, if your patients are not in any of those scenarios, so they've never had a Lurie exposure and you're not part of a Community Connect practice, we have expanded access to scheduling options for patients to request their appointments through the website, and a structured process by which those patients can get those appointments within 48 hours. And so if we flip to the next page, I'll start with a lot of this text got overlapped. My apologies. We'll send out some of these slides afterwards Chad, with the correct formatting. But at a high level, if you look at the website, two pieces I want to bring your attention to. So for patients that are less than 12 years old or older than 18, we've made it a significantly streamlined process to get patients signed up. Again, full transparency, about 3 months ago, about 25% of phone calls that came in having any issues with signing up for MyChart led to some sort of escalation and the patient needing multiple phone calls back. That is now down to 5% of any issues. And those are mostly around verifying the patient, the guardian's identity and make sure that that proxy access is appropriate. For patients 12 to 17 years old, that's the second arrow that's pointing at the button. We will now have digital authorization forms by the end of this month. So patients who are in that bucket can just go online, get those forms filled out, signed by their parents as well as the patient, and then they will receive an email with the activation link to sign up for MyChart within 2 days. And so that's a lot of the foundational components. I'm going to go ahead and share my screen.
Yeah, that's fine.
Chad, I think the screen sharing option is disabled, or can you guys see my screen now?
Yes.
Okay, excellent. So this is what I was pointing out. So this button, the sign up for MyChart Access, is crucial, and then as well as the authorization forms, getting patients signed up within 2 business days. And so as we tackle apologies, I just want to make sure I'm showing you guys where we are. I'm going to show a demonstration of what it looks like for patients scheduling an office visit with any of our specialties and what we'll be moving towards as Corey outlined on previous pages. So if you guys can see my MyChart, I'm logged into my son's account. This is something that all of our Community Connect practices, again, I'll emphasize, will have access to starting next Thursday. And so they would just go to their MyChart login, go to their appointments page, and then click on schedule an appointment. Once they schedule an appointment, they will then have all of these options to schedule any of these referrals. So otolaryngology, gastroenterology, nutrition, ophtho, ortho, and pediatric surgery. There's more to come, but I'm just going to run through this process so that those of you who are not familiar with this have a good idea of how easy it will be for patients to get scheduled. And so if you click on ear, nose, and throat, we'll start with a few questions just to make sure that the patient is appropriate to be seen and is seen by the right, back to what Matt was saying, right provider at the right time and the right urgency. And so we'll start with, does the patient have a trach or a cochlear implant? And if they don't, it'll ask the patient to make sure that they bring a referral if it's necessary for their insurance. And then it's pretty straightforward. What's the patient's primary issue? If it's in their ear, great. What is their problem? Let's say it's recurrent ear infections. Has the patient had frequent ear infections in the past? And this is mainly to make sure that they would be considered to be a surgical candidate. And so more than 3 in the last 6 months. And then have they had an ear infection in the past month? This would help rule out whether or not the patient would be available for or have an option for same-day surgery. And then it's just to make sure that they don't have any other medical issues that we need to be concerned about in the next couple of questions. And as soon as you answer those few questions, as you can see, pretty straightforward, patient-friendly, trying to get patients scheduled, you then have the options of selecting whatever locations as well as providers. If you want to make a referral to a specific provider, you can just have the patient select from available providers, or you can then choose multiple locations. So let's say this patient is willing to be seen downtown at our Clark and Deming location as well as in Skokie. We would hit continue, and then they are willing to be seen by any of our providers. We would hit continue, and their first available appointment would be tomorrow with Dr. Billings. They would be able to click on it and then schedule their appointment with Dr. Billings and be seen. And so I emphasize that because as I go back here, we'll see our currently available specialties are these: the orthopedic surgery, otolaryngology, optho, ped surg, gastroenterology, and nutrition. By May 18th, probably earlier in many of these cases, we'll have these additional divisions going on live and being available on my chart. So these decision trees will be built out not only to streamline those calling into the centralized access center so they can have a quicker phone call, but also giving the patients the ability to schedule their own appointments. This will then expand in September to the next set of divisions, and then by January of next year, we'll have completed out all of our divisions and referrals. There are a couple of divisions that will still be kind of left out due to the complexity associated with transplant surgery and cardiac surgery. But outside of that, pretty much all of our divisions and all of the services provided at Lurie will be available for online schedule. And then the question becomes, well, what if you don't have a previous Lurie exposure or you're not a Community Connect practice? You may not be able to use what I just demonstrated. In those cases, we've added the Make an Appointment button on our homepage. So you just have your patient click on Make an Appointment. From there, it'll take them to this page on the right-hand side. They would click on the appointment request form. And from there, they would see this appointment request form on the right-hand side that they can fill out. It's about 20 fields or so. It takes about 3 minutes to fill out for a patient online. Once they fill this out, they will get a phone call back within 2 business days. And we've been able to maintain that as far as making sure that the patient can get a phone call back and get their appointment scheduled. Notably for referring providers, our Epic request for services and referrals via Epic Care Link will continue to be available. So you can continue to send those over through that process. But if you do want to have your patients kind of take the responsibility of making their specialty appointments, this is a great venue by which they can then make it a streamlined access for them and not having to sit on hold, wait for phone calls back. We can get it to the right place at the right time. So I'll end there. I'll hand it back over to you, Chad.
Well, thank you. That was just absolutely fantastic, and I'm sure there are a lot of questions out there from many of you, and I would encourage you to put those questions in the chat room, or when we're done thanking everybody, we can go ahead and raise your hand and unmute yourself. But I'd like to take this opportunity to thank Nora, Matt, and Dr. Patel for joining us today. As well as Kate Schmeissing from our Skokie office. What you have provided us today is priceless information for our providers who refer into Lurie Children's, because access is a huge part of the way we communicate with our practices, and to make it easy for them, like I said, is priceless. So I just want to thank you all for doing that. But at this time, I'd like to encourage anybody to ask questions. If you have questions for either Kate or Nora or Matt or Dr. Patel, either unmute yourself and ask the question, or go ahead and type it in the chat room.
Dr. Patel, this is Julie Kalkbrenner. I did have a question that has come up from the community. Now, with some practices, they like to handle their referrals at the practice level. And some of the patients that they have may be challenged with technology or may not have access to it. Is the practice able to kind of build out like a My Chart for the patients where they're not able to, a patient family isn't directly able to hold the My Chart account, just so the practice can finish scheduling for the patient?
So they can support the patient to help the patient make their own My Chart account if that patient has been seen at Lurie in the past. Unfortunately, the practice cannot hold that account. So that account is a proxy account that gives a parent access to their child's medical information at Lurie. And so it would not be at the practice level that this would be. There's no harm in having your practice kind of support a patient and getting signed up. But it wouldn't be something that the practice themselves could hold. I think that may answer your question. If not, feel free to head on.
Okay, so I guess a practice could also help the family when they are on site at the practice to make the My Chart profile. Is that
correct? Yeah. So they can support, I mean, it's really streamlined. So as I showed on that web page, as soon as you click on the link, you'll submit just basic information, identifying the patient, as well as the proxy, dates of birth. Once you put all that information in, you can then, they should get an activation email. If it's during business hours, they can get it pretty quickly, soon thereafter. But we do allow 2 business days to allow for any requests that come in kind of late Friday or over the weekend.
Okay. And then we do have another question. Will the online scheduling also be available for lab draws, radiology, and other ancillary services?
So the online scheduling will not be available for lab draws because most of our lab draws are kind of walk-in services as they are right now. For radiology services, there's ticket scheduling in place. So as long as an order is placed in the system for an X-ray or an ultrasound, the patient will actually get a notification as a quote to do, in which they will then go into my chart, be able to, the order will already be there. So the patient's not responsible for putting in what type of X-ray or type of ultrasound is necessary. It's linked automatically. They then just pick a date and time and a location at which they want to schedule that appointment.
Okay, and then when the physician order goes through for the radiology screening, that can be done through the RFS as well, correct?
Correct.
Or KidStack? Okay, all right.
Matt, feel free to chime in on that, Matt or Corey, but.
Yes, so if we were submitted an online appointment request, we would then be able to either schedule if once everything's on decision tree specific to the radiology. But right now we would take that appointment request, generate the appropriate RFS, and make sure that it's sent to the lab directly or imaging, etc. So we would be able to triage that appropriately.
Okay. And so for patients that are looking to go to one of our satellites specifically, like a particular location, is it best for them to, can they schedule through the satellite, or should they be scheduling directly through central scheduling or the online scheduling? Is there a preferred method?
So,
go ahead.
Yeah, so I mean, they should call the Centralized Access Center, or they should do it through online scheduling, and then let the preference be known to the scheduler. And whatever appointments are available, we'll share with them appointments that are available at any of our satellite locations. So just like I showed in the demo, they can over the phone explain to our schedulers, hey, they're willing to be seen at any of our northern suburb satellites, or specifically only want to be seen in Northbrook. We can then filter and only share those appointment times over the phone. If they're online, they can kind of choose and pick based on the availability. So if they only choose one location, that will limit their options. So I will be very frank and straightforward on that piece of one of the complaints that we've heard is the time to first appointment. We're trying our best to kind of create availability at all of our satellite locations. But the more flexibility there is in location as well as providers that can be seen, obviously there's more appointments that are available in getting those patients seen.
Thank you. Matt, did you have anything to add to that?
Not after that response. It was better stated than I could have done. So thanks for taking the lead on that one, Ravi.
I will add on, I think there was a question from North Arlington Pediatrics. So in terms of referrals, online scheduling will also have the same requirement for referrals. And this is a requirement by many of the HMOs and insurers that we see or we have as payers for Lurie. And so, yeah, it is, the RFS should suffice for the referral. But just please note that even if a patient does do it online, that RFS will still need to be submitted to make sure that referral is in the system, because that is what allows for that appointment to actually occur, and to make sure that the services aren't billed back to the patient, their insurance can actually be used.
Great point. Thank you for reminding us on that. So we still need to, can't get away from that RFS.
Yep.
Okay. All right. I don't see any other questions at this time in the chat box. But this has been excellent information. We're very excited to roll out our digital front door and just allow another opportunity for patients to and physicians to have better access to our specialists and services at Lurie Children's. So it's great information, and I appreciate all of the sharing of information here.
Yes, it's been fantastic, so thank you. You know, Julie, Paula, and everybody else, you know, I did want to ask, now that the presenters are done, to kind of, I want to go back to what I was talking about as far as our virtual meetings and how we're introducing our specialists. For those of you still online with us, do you have any time preference when we set up these meetings? So does a 12:30 start time or a 5 p.m. start time, any of those times work better than others, or is it variable because your schedules are so undetermined? We would love to hear any feedback from that.
And the second thing we'd love to hear feedback is, for future meetings like these, what do you want to hear about? Who would you like to hear about here at Lurie Children's? Who would you like to present?
And looks like Kate from Skokie went ahead and typed in, for those of you who didn't see it, she says, if you have any further questions about our new Skokie Outpatient Center or would like a tour, feel free to contact her at 312-227-5620. And it's Kate Schmeissing, manager of Skokie. Also, feel free to contact me as well if you're looking for a tour. I'd be happy to come with you and do that as well. Well, Paula, Julie, it sounds like nobody else has any questions. So is anybody, Paula or Julie, do you have anything left you'd like to add?
Thank you for joining us, and thanks to all our speakers.
Thank you all for the time. We appreciate it.
Okay, well, thank you, everybody. You have a wonderful afternoon, and stay warm, and we will see you in the spring for our next quarterly symposium. Have a wonderful day.
Thank you.